Makeshift triage tents set up outside this Hong Kong public hospital for the third day. Dozens of patients, many of them elderly, wrapped in emergency blankets in the cold and windy weather as they wait for space to free up inside. Hong Kong's hospital system is buckling under its worst wave yet, driven by the highly contagious Omicron variant. Hotels are now freeing up rooms, and a fleet of taxis have been recruited to help cope with the surge. Officials are also relaxing some isolation policies to allow some patients to be discharged sooner. Yet there are no signs the government is willing to abandon its dynamic zero-COVID strategy, and Beijing has made it clear Hong Kong should follow its no-tolerance approach to the virus. On Thursday, Chief Executive Carrie Lam said the government is considering testing all of Hong Kong's 7.5 million residents, once enough rapid antigen tests arrive from mainland China. Lam was at the border to greet medical experts who are in the city to help bring the outbreak under control.
After we have this testing ability, then a complete and comprehensive testing across Hong Kong is one of the measures we are considering.
There are mixed reactions to the proposed plan.
I hope the virus can be stamped out. If the government wants us to do the mass testing, I will support it.
People are mobile. If the mass testing is not done all at the same time, people will infect each other, and testing will be useless.
The death of a 3-year-old girl on Tuesday appears to have triggered a vaccination rush for young kids. Vaccination rates among Hong Kong's elderly remain sluggish at less than 30%. And with temperatures expected to drop in the next few days, the outlook is bleak for Hong Kong's most vulnerable people. For most of the pandemic, cases here remained low, and Hong Kong watched as other hospital systems around the world struggled to cope. Now, COVID-19 infections here are exploding, and there's frustration the government wasn't more prepared. Clennet, Jazeera, Hong Kong.